going.
Okay, so then what makes you qualify as a practitioner? I know for nutrition, I go into a completely different style of education. It's not a dietitian route, it's not pre-med or anything like that, it's an actual schooling. What, for like a medical doctor or nurse practitioner, what do you do to make sure that you're actually qualified?
That's a good question, because basically there's almost anyone can call themselves a functional medicine provider. I'm a physician, I'm a traditional trained physician, so I went to med school, I went to residency, and I can do all of the things that a traditional family doctor can do, whether it be prescriptions, vaccines, whatever it may be. I can do all those things. But then after I graduated from residency and finished all of that training, I went above and beyond to learn more and more about functional medicine, using holistic medicine to heal people and get down to the root causes of whatever that may be. In addition, I spent tons of time learning about nutrition, since we're only given 1 hour of nutrition knowledge in med school. So I spent extra time learning all that. I spent thousands of dollars going to the Institute of Functional Medicine, the IFM, did all of their courses, became a certified functional medicine practitioner through them. And so I guess those are the things that I would say make me qualified to be a functional medicine doctor and kind of set me apart from anyone else saying they do holistic medicine or integrative medicine.
Right, because then you can have a naturopath or another MD or anybody else doing integrative, right? But functional medicine is a whole nother certification.
Yeah, and I kind of, the way I see things, whether this is right or wrong, the way I see things is traditional medicine is way over here, functional medicine is way over here, integrative medicine is somewhere in between. So the kind of benefit of functional medicine, the way I see it, is it's like the Matrix pill. There's no gray pill. There's the red or the green pill. I don't remember the colors.
I don't
Red
either.
or green.
I've never seen it.
We swallow the pill. We went whole hog. It's functional medicine. We're gonna figure out a root cause of your symptom, whatever it may be. There's a root cause, whether we know it or not, but we're gonna keep looking until we find it.
Right, and I feel like all the patients who've come here have been through conventional medical kind of like realms that have failed them.
Yeah.
Right. So, and we kind of understand what a typical functional medical visit is like. What do you feel like the best way explaining to people how the treatment plan is? Because it's a loaded question. We're very spoiled, we are.
Because I still remember the days of being in a traditional medical practice where we had a new patient visit and you were scheduled for 20 minutes. And many times we ran over to 20, 25 minutes, but that was a long visit in the traditional medical world. Still is a long visit in the medical world. But in the functional medicine world, we get 90 minutes with our new patients. I get 90 minutes, you get 90 minutes as a nutritionist with them. And then if they see the therapist commonly, they get 90 minutes with the therapist as well. And so a big part of it is just time. It's almost impossible to get your story out in a matter of 20 minutes. And even if you can get your story out in 20 minutes, you certainly can't get to a solution in 20 minutes. And you certainly can't change your lifestyle, fix your diet, whatever it may be. So that whole first visit, 90 minutes, that's still not even enough. But that 90 minutes is at least a good way to start, to find out the story, get a treatment plan started, get some blood work, labs, stool study, whatever it may be cooking, and then we have more and more visits. The idea of what people are kind of subjected to nowadays in traditional medicine is, like we said, we're spoiled that we get so much time. Our follow-up visits are 60 minutes usually. Eventually patients start decreasing down to 30-minute visits, especially for me, because they just don't need as much time. Right. They've got their plan. It's less movement in their plan.
And our patients are very compliant, so they get better when people don't.
Yeah, the non-compliant ones get longer, right?
I know, and then they just pay more, but that's okay. That's fine. Okay, good. So let's say if you had a scenario of someone who had rheumatoid arthritis, right? Conventional medical way would be going to an autoimmune specialist, right? Or rheumatologist. And then functional medical route would be coming to us, and we're figuring out, okay, we understand that you do have rheumatoid arthritis, but why? And that's where we do the stool study, organic acids test, blood work, things like that. Okay, so that's a good way of. So we get a lot of patients, right, who come in here looking for help. What is the best way to explain what type of patient is suited for functional medicine versus conventional medicine?
Well, that's a loaded question, because anyone can be a functional medicine patient. I'm a functional medicine patient. You're a functional medicine patient. Because we really do have something to offer for anyone and everyone. Commonly in our videos and things, we're focused on the people that are suffering. Yeah. Like you just mentioned, with rheumatoid arthritis or psoriasis or lupus, whatever it may be, an autoimmune condition where they are suffering. But functional medicine has the ability to prevent you from suffering also, right? Because why wait until you do have rheumatoid arthritis? Why wait till you have that heart attack? So really there's something for everyone in functional medicine that we can help them get healthy stay healthy, preventive medicine. It is the ultimate version of preventive medicine. I know in conventional medicine they talk about your wellness visit or your annual physical or whatever, but the main thing they're doing is they're doing cancer screening tests, they're doing vaccines, they're checking your blood pressure and your weight, but they're not truly diving deeper down to see what are some of the underlying causes that could be going on that you may not even feel. You may have inflammation in your blood work. I was a prime example. I started doing my blood work in my early 30s and I had terrible inflammation. My CRP was 8. And
oh my God.
Don't make fun of me. So 6 years ago, my CRP was 8. It's
What's
not
it now?
8. It's under 1 now.
Okay,
Thank you very
okay.
much. But I did. I had arterial inflammation markers. I had LPPLA2 elevation. I had plenty of inflammation, but I didn't feel it. I'm not one of those patients that felt inflammation. I'm the patient that in my 50s I would have had a heart attack, looking back, going, "Why me? I never had any issues." Right. Whereas others have inflammation, they've got joint pain, and brain fog, and fatigue, and whatever it may be. So really, the original question was, what's a good patient for us? And it truly is anyone.
Yeah.
I'd say probably our bread and butter, the people that come to see us most often, are the people that have seen multiple doctors, taken multiple drugs, they're tired of taking drugs, they want to get down to the root cause, they want to get off of medications and feel better. Because many of them are taking medications and don't feel good.
Right, or you have those patients who've been tossed around, you know, and I've been one of those, multiple people in our practice have been one of those, and then never got better or felt better.
Yeah.
And it wasn't until A, we did our own education, or B, actually saw a functional medical provider that we understood why we were feeling that way.
Yeah, the medical merry-go-round of this diagnosis got you started. We had one of our patients recently. She went to see a cardiologist for something, and then the cardiologist uncovered something else. She had to go to another specialist, and she ended up in this medical merry-go-round. And it wasn't until she talked to us to say, "Whoa, wait, like how did I get here?"
Right.
It's one thing after the next, and it all stemmed from one inappropriate test, which was like, well, there's no harm in testing. Well, there was a harm in testing, and it led down this whole medical merry-go-round that didn't affect her life and didn't change her life, but a procedure from that test could have changed her life.
Okay. So everybody can be.
That's right.
Okay. Okay, good.